Imagine this. You visit your elderly parent one afternoon. They're sitting in their favorite chair, staring at the TV. They smile when you walk in, but something feels different. They're a little more forgetful. Maybe they have trouble finding the right words. You notice they can't quite move as confidently as they used to. At first, you think it's just normal aging. But here's the truth. Could be a silent stroke, and it happens far more often than most people realize. Silent strokes often cause subtle changes that families miss. Unlike a classic stroke, there may be no sudden collapse or slurred speech. Yet over time, silent strokes can seriously damage the brain, robbing your loved one of their memory, balance, and independence. Today, we're going to talk about what a silent stroke is, how to spot the signs, how it's diagnosed, what recovery looks like, and most importantly, what you can do to help prevent it. Let's get started. To understand silent strokes, it helps to picture how the brain works. Your brain needs a steady supply of blood rich in oxygen and nutrients. When a blood vessel in the brain becomes blocked, often by a tiny clot, a part of the brain stops receiving blood flow. In a typical stroke, this causes immediate, obvious symptoms. Sudden weakness on one side, slurred speech, facial drooping. But in a silent stroke, the blockage affects a smaller area, often deep inside the brain. There may be no dramatic symptoms at first. Instead, the damage is subtle, affecting memory, thinking speed, coordination, and emotional control. This is why doctors sometimes call silent strokes brain attacks without alarms. And here's the scary part. Researchers estimate that more than 1/3 of seniors over 70 have had at least one silent stroke without knowing it. Over time, repeated silent strokes can lead to vascular dementia, a condition that slowly erodes memory and thinking. Several factors make older adults more vulnerable. Aging blood vessels. With age, arteries can stiffen and narrow, increasing the risk of tiny clots forming. High blood pressure. Hypertension is the leading cause of small vessel blockages in the brain. Atrial fibrillation. An irregular heartbeat can let clots travel to the brain. Diabetes. This damages blood vessels over time, raising stroke risk. Smoking and high cholesterol. Both accelerate plaque buildup in arteries. Even if your loved one seems healthy, these hidden risks can silently damage brain tissue over months or years. While silent strokes don't cause the same dramatic symptoms as major strokes, they do leave clues. Here are 9 signs you should never ignore. 1. Sudden difficulty with balance or walking. Maybe they seem unsteady or shuffle their feet more than usual. 2. Changes in short-term memory. Struggling to remember recent conversations or where they put items. 3. Mild slurring or trouble finding words. Not as obvious as a full stroke, but noticeable if you listen closely. 4. Unexplained mood changes. Irritability, depression, or apathy that wasn't there before. 5. Loss of interest in hobbies or activities. They might withdraw socially or stop doing things they love. 6. Difficulty concentrating. Trouble following a conversation or completing simple tasks. 7. Small, subtle weakness in one hand or foot. Perhaps dropping things more often or dragging a foot slightly. 8. Frequent falls. Sudden clumsiness without an obvious cause. 9. Confusion about time or place. Momentary disorientation that feels off. If you notice any combination of these signs, it's time to see a doctor. Early detection is critical. Because silent strokes don't announce themselves, brain imaging is often the only way to confirm them. Here's what the process looks like. Neurological evaluation. A doctor will ask about memory, movement, and behavior changes. MRI scan. Magnetic resonance imaging can reveal tiny areas of damage called lacunar infarcts that indicate a silent stroke occurred. CT scan. Sometimes used if MRI isn't available, though small strokes are easier to spot on MRI. Blood tests. These look for diabetes, high cholesterol, clotting problems, or infections. Heart tests. Electrocardiogram, ECG, or echocardiogram to check for atrial fibrillation or other heart issues. Many people are shocked to see evidence of multiple silent strokes on their MRI, even though they never had classic stroke symptoms. Recovery depends on the size and location of the stroke, whether it's the first or one of several silent strokes. Underlying health conditions. Unlike major strokes, silent strokes usually don't cause severe paralysis. But they can worsen memory and thinking, increase the risk of falls, lead to long-term cognitive decline. Recovery timeline. First 1 to 2 weeks. Some confusion and fatigue. Mild speech or coordination issues. 1 to 3 months. The brain can partially rewire to compensate for lost function. Rehabilitation exercises help restore balance and thinking speed. 3 to 6 months. Most improvements plateau. Memory aids and therapy can help with residual deficits. 6 to 12 months and beyond. Some people remain stable. Others may experience gradual decline if additional strokes occur. That's why prevention is just as important as treatment. As a caregiver, you play a critical role. Here are 6 ways to support recovery and protect their brain. 1. Monitor their medications. Make sure they take prescribed blood pressure, cholesterol, and diabetes medications consistently. 2. Encourage physical activity. Gentle movement improves circulation. Even daily walks or seated exercises help. 3. Support healthy eating. A diet rich in vegetables, fruits, lean protein, and whole grains reduces stroke risk. 4. Provide cognitive stimulation. Puzzles, reading, music, and conversation keep the brain active. 5. Use memory aids. Calendars, sticky notes, and labeled drawers can reduce frustration. 6. Watch for new symptoms. Any sudden weakness, speech difficulty, or confusion should be treated as a medical emergency. Silent strokes can be unsettling because they feel like something that snuck up on you. You may wonder, is this my loved one's new normal? Will they keep having more strokes? Is there anything I can do to stop it? The answer is, you can absolutely make a difference. With early detection, medical treatment, and daily care, you can help your loved one maintain their independence and quality of life. Most importantly, remind them and yourself that small setbacks don't define who they are. Compassion, patience, and routine can help them feel safe and supported every day. Here are 7 proven strategies to reduce the risk. 1. Keep blood pressure in a healthy range. High blood pressure is the #1 risk factor. 2. Manage diabetes. Check glucose regularly and follow dietary advice. 3. Control cholesterol. Medications and diet help keep arteries clear. 4. Treat atrial fibrillation. This heart rhythm problem can send clots to the brain. 5. Quit smoking. Smoking damages blood vessels throughout the body. 6. Exercise consistently. Even 30 minutes of walking most days makes a huge difference. 7. Eat a heart-healthy diet. Think Mediterranean, olive oil, fish, nuts, lots of colorful veggies. If you've noticed subtle changes in your loved one, small lapses in memory, slight speech issues, or new clumsiness, you are not overreacting. Silent strokes are real. They can be detected. They can be treated. And with the right steps, they can often be prevented from happening again. If you take one thing from this video, let it be this. You are your loved one's strongest advocate. Never be afraid to ask questions, push for answers, and seek care. Because every moment of clarity and connection you help preserve is priceless. Thank you for watching this in-depth guide on silent strokes in seniors. If this video helped you, please subscribe to the channel for more practical guides on senior health and caregiving. And if you know someone caring for an aging parent or grandparent, share this video now. Sometimes one conversation can change everything. Stay informed, stay compassionate, and remember, you are not alone.